The cardio-oncology team is, I think, depending on where you work, if you have access to a cardiologist who has a particular interest in the management of patients with hematological malignancies, then that's really great. Traditionally, cardio-oncologists were useful in helping to manage patients with, for instance, anthracycline-related cardiotoxicities, so a common chemotherapy drug which we use for lymphomas. I think in the era of targeted therapies, and in particular referencing BTK inhibitors, and more specifically covalent BTK inhibitors, which are known to be associated with atrial and ventricular arrhythmias, having a cardiologist who is readily able to assist in the management of these patients when they develop these complications is critically important. It does get pretty tricky managing atrial fibrillation when you have patients who may have pre-existing cardiac comorbidities, if they have left ventricular failure as well, for instance. If they develop atrial fibrillation on top of that as a new thing in the setting of covalent BTK inhibition, then having a cardiologist on hand to help with rate control and managing issues with blood pressure is extremely useful. Patients, the development of palpitations is quite a common symptom in any patient, over about 70 years of age. Palpitation is a reasonably common symptom, and again, when you've got a patient taking an oral continuous BTK inhibitor, particularly covalent BTK inhibitor, rapidly working out which patients are potentially at risk of dangerous arrhythmias versus those who have atrial fibrillation and need, amiodarone or whatever other rate control is critically important in safely managing patients on these drugs.